Tēnā koutou katoa, welcome to eHealthTALK NZ. Today I'm joined by Phil Baskerville, Digital Project Director for the new Dunedin Hospital, to discuss one of New Zealand's most significant digital health and infrastructure projects. The new Dunedin Hospital project is about redesigning how services operate, creating a digital-first environment. Phil, welcome on the show, and can you just start by giving us an overview of the project and where it's currently at?
Cool. Thanks for having me. New Dunedin Hospital has been underway for a number of years. People will have seen some news about the inpatients building that was reviewed, but that is going ahead and construction's underway for the inpatients building. But what we're talking about today is the outpatients building. So the project was split into two phases, and we're super close. We're about to get the building finished and then start commissioning. So it's 15,000 square metres of clinical space, primarily a walk-in, walk-out approach. So there are some theatres in the building, and that's for day surgery and a day unit. So it's very much a walk-in, walk-out. People aren't admitted. So it's a day building, which is super exciting.
And so you've got the hospital building, and I understand you also have a digital health design lab. Can you just tell listeners how that connects to the new hospital and its role?
Yeah, so this was a really key asset for the program. What it has enabled us to do is stand up every piece of digital equipment that's going into the new building. And we've been able to run our cyber assurance exercise over it. We've been able to profile the devices as they go into the network because it's future state and modern environment. We've got a software-defined architecture environment. So everything, we need to know every device that connects. So because it's a public building, we don't want to leave, I suppose, the network vulnerable to people just walking in off the street and plugging a device in the wall. So it's very much a tied down network, and we've been able to run all the assurance pieces over every new device going in. So every security camera, the door tags, every Wi-Fi access point, we've been able to get everything configured across the road because it's literally across the road from the new building. And we've been able to walk clinicians through, members of public, and we've used it as very much a prototype environment where people can see the tools, the new devices, and sort of they can imagine themselves in the new building. So it's been super valuable in showing early, so people can see what's coming down the line, and I suppose critique and get feedback on the new designs that are coming in.
And so one of the major goals outlined in the ministerial business case for the new hospital was the removal of paper medical records. Why was that important, and how are you going about achieving that?
We've gone about that sort of really systematically, looking at the amount of paper that's generated and targeting the high volumes of paper that are currently being scanned. So we've got a digitisation or a scanning bureau established, so they can take any of the paper records and be scanned. And we've looked at the volumes that were scanned, and we've targeted those high volumes. So we're talking about prescriptions, the infection prevention control survey. There's a whole lot of bits of paper that are used throughout the building and throughout the hospital. And so we've really targeted the high volume first, and then that's a sort of a trailing tail. So because the building's split campus, so it's a block and a half away from the existing building, there won't be the back and forth. And being able to have everything digitally recorded and not have bits of paper generated in the building cuts down operational expenditure, ease, efficiencies, all those good things that you'd expect in a modern workflow. And also it's the places to store it as well. So the building's not actually been designed to hold paper like the existing campus has been. So there aren't cubby holes full of paper forms for people to just fill out. So it's very much been designed not to hold paper. Therefore, we've got to come along and put that into action. So that's why it was there, because the building's not been designed for paper to be used as that medium.
So you've also developed a digitally enabled patient journey, and that's involved co-design with clinicians, administrators, and the community. Can you just talk about what that journey looks like, and what did the process reveal about how people experience outpatient care?
The journey is something that time and time again is a really good artifact to agree on. And when people can see the patient journey and taking that patient-centric view of the process, They can see themselves in it, they can see where they interact with the patient, and they can see the downstream effects or downstream artifacts that need to come out of it as well. So we came up with that as early as we could and really, really honed in on where inefficiencies for the patient, where are the inefficiencies for staff and kaimahi, and how do we work on those things and see the duplication as well, because in the current environment, there's lots of duplication, say with text messages and sort of trying to consolidate down to a single source. So it's very much that process where you can see, okay, this is the pre-appointment processes. This is what we need to do. This is why someone might want to communicate with the patient a week before the procedure. These are the reasons why we want to notify or remind them 24 hours before the appointment so that they turn up on time. And it's really about having the building operate and how the building with all the different services that are within it, I suppose, have a common process and a common understanding of when and where patients will be notified, staff will be able to see who's coming, and that side of things as well. So it's very much about shared awareness of really how the health system as one interacts with the patient.
That's often the trickiest part of these projects, isn't it? It's not the technology, it's working out what is the current process, what's the difference across different specialties and things, and getting an agreement around what it might look like going forward. So from a patient point of view, can you just talk us through where, if say it starts at home, what the digital journey would look like if they were coming into the new building?
Yeah, so from the beginning, we've looked to use digital where we can, where people have opted into it. So we'll give people the opportunity to log into a portal using their My Health account, which they use to log into other health services using two-factor authentication. So using up-to-date and good, safe, modern practices. They'll be able to accept their appointment online. They'll also be able to receive text messages as well, sort of reminding them that their appointment's sort of 24 hours or 48 hours away. They can then come in, and this is where the digital and paper sort of processes merge, because people will still be given a letter if they so choose. So they can turn up with their letter and then they start interacting with our self-check-in kiosks. So they can come in, scan their letter or find themselves in the NHI and then basically check themselves in, and they'll be guided up to a reception area using the sort of the coding of the building, whether it's level 1, 2 or the ground level, and then work their way through that process. They'll also have the opportunity to use the portal itself and check in on their own device, and say in the car park, or if they're driving in from out of town, they can check in and say, yeah, I'm here. So really making sure that people know that people are on their way, because I think this is one of the big concerns that people have, is making sure that patients turn up at the right time and they're in the building. So there'll be a cafe on site that people can wait in if they so choose, a parent and family whānau area as well, and then they'll be advised that they might need to come up to the clinic, or they might be advised there might be a slight delay. So it's just keeping people aware and not needing to have a huge waiting room of people all sitting around for 2 hours before the appointment.
And as you said, you have retained personal channels, human or paper channels, alongside digital options. Why is it important to always provide that choice, and how do you sort of strike the right balance when looking at that?
We think about parents a lot. How do our parents interact with the health system? Because a lot of our parents already are outpatients appointments. So a colleague's mum will post their letter or stick it to the fridge, and that will be their reminder on that day they've got to turn up, and they'll take the letter along. So we're not forcing anyone to adopt the digital channels. It will very much be an opt-in. So they'll still have the letter arrive in the post if they so choose, and they can bring that letter in, and they can walk up to a kiosk and they can check themselves in. There'll be roaming sort of concierge staff as well to help people. And if all else fails, they can always go to the front of house staff. So it's making sure that we never force digital on people. It's always about their choice. And if people aren't comfortable with it, they can still turn up with their letter, talk to a human, and be guided on their way.
At Digital Health Week last year, 2025, you spoke about having to dig up State Highway 1 to lay fibre because drilling wasn't possible. And it made me wonder, what are some of the unseen infrastructure challenges that come with building a modern digital hospital like this?
Yeah, I was thinking about this, and this could be a whole nother episode. But no, I think it's probably the biggest lesson is we've got a date and we can't move. So we've got to be super prepared and make sure that we can't ask for that extra week, whereas typically with the digital services or a digital program, you might be able to stretch that time out, but we've got a date that we need to hit. So that's the one thing that's never been able to change in this program. We needed to, I suppose, start commissioning all our networking and communication rooms early, and in a building site with a whole lot of dust and jib dust and self-leveling compound dust and all sorts of dust, all the dust you could imagine. We need to work really hard to protect those communication rooms so we could install our gear, start the early provisioning and early cabling that was required to make the date. It was a joint lesson for all involved that digital a part of the building process, not a sort of afterwards, because the building systems all need the network and the some of the on-site compute and storage to actually operate. So they need to be in there well ahead of time. And so it's just that balance of going in early enough that people can have enough time to, say, commissioning the air conditioning and the security systems. We've monitored dust levels. We've bought a fancy little gizmo to actually manage the particles in the air, and we're able to use that a couple of times to sort of shut down some machines or shut down some networking rooms when those dust levels got up. It's been, interesting.
Yeah, becoming a specialist in dust level is probably not something you'd anticipated. I imagine there's an enormous amount of cabling gone in as well for something like this.
Yes, kilometres and kilometres of it. It's I suppose that's what's needed, and that's where being involved in the building phase of the project is so valuable, because it's enabled us to have a future-proofed digital hospital-ready infrastructure in place. So it enables systems down the line to come and make use of it all, whereas it might not all be used on day one, but it's certainly ready for that sort of the digital improvements in years to come.
And also universal mobile coverage you've got. That was obviously an important part of that design as well.
We've partnered with the Rural Connectivity Group, who offer the shared rural 4G and 5G now, but they're the crown entity that partners with all the mobile network operators to provide those shared cell towers around the country. And because it's a public building and we're relying on text messages to talk to patients if they're in the waiting room, we need to make sure that there's mobile coverage throughout the building. It's a large bit. There's a big lump of lead in the radiology suite on level 1, which makes it really hard for cell phone signal to get around the building. And especially for members of the community, communicating with, say, a family member to say, hey, I'm finished now, can you come pick me up? If that mobile service is not there, it makes it really hard for patients to actually use the building as well. So it was very much, because it's a public service building and people will come in and out of it all the time, we need to make sure that there's connectivity and people can use the building as it's been designed. So yeah, there was a new agreement that needs to go through all the proper processes, and we got that through, and it's able to be reused for other sites around the country as well. So it's a really exciting development, and yeah, enables mobile coverage throughout the building. So it's a really good advance for the organisation.
Fantastic. And you also spoke at the conference about commissioning readiness and governance structures, and saying that these were established around a year before opening. I'm just wondering why you need to begin this work early. What are the risks if you leave that sort of thing too late?
Because of that date can't move, I think is probably the thing it comes back to, is because we've got that date and things are really pressured once we've got the building to open it. We can't spend sort of 6 or 12 months getting people ready to use the building. So it's as much of that work done beforehand as possible, engaging with all the clinics and services that are using the building, making sure that their input and requirements are built into everything that we do, and having a specialised sort of change, training and commissioning team. It's a lot of work. I think it's probably the really short answer is it's a lot of work, and you need a large team to do it, especially moving a clinical and administrative workforce that are already busy, and they don't really have sort of 20% slack in their day to pick up some extra project work as well. So being able to walk in and offer a helping hand as opposed to a long list of to-do items.
So I understand that rather than waiting for opening day, you've been releasing technology changes incrementally into the current system or into the current hospital. What's the thinking behind introducing change gradually rather than one big bang launch?
Some of our solutions need the building to actually be there to work. So we're relying on some built infrastructure and a change of ways of working. Whereas some of the systems of updates we're making don't actually need the building to be live, but the building does need them. So that's a sort of slight disconnect there, which is a good opportunity. We've been able to implement sort of staged releases. We've digitized outpatient prescribing, so people can write those electronically. We've been able to do some outcoming work, update some dashboards, get some changes made to our core platforms, use some of the clinic room scheduling tools as well, because it's a shared space and it's the rooms aren't owned by clinics or services. It's very much a shared space. So we've been able to get administrative and service staff comfortable with those new tools early. So because we know there's going to be a big enough change, it was how do we implement early and people can start seeing the changes, and it helps reinforce that change is coming, and then they can have a bit of faith that when we say, yep, we've got a release coming in on the 12th of July, and the release comes in and they see that new functionality available. So it's really just that sort of that staged and build up of those digital improvements.
And you mentioned earlier sort of the need for all the work streams to essentially work together to make it through to opening day.
Yep.
How has that philosophy kind of influenced the way the teams have worked together across like digital? Then you've got clinical, you've got operational, and the infrastructure functions.
A good example is probably that new way of working with the shared rooms and how we've been able to work with the I suppose the operational readiness team have been able to engage with the services and clinics that are moving, work them through, say, what does a timetable look like for your rooms and your clinics you want to run. And that's a sort of very much the operational readiness conversation. Then the digital conversation happens about, okay, how does that change the current schedules inside the patient administration system? And it wasn't just one team responsible for it. It was drawing sort of operational and clinical readiness teams as well as digital, and then feeding back to the services, having the services signed off. And so, so very much that sort of joined up approach between the different programs, the building, the operational readiness and digital. So it was very much, that's probably the freshest example. And just really driving that strong team collaboration.
Yeah, nice for digital not to be an afterthought, as you said, especially when you need mobile coverage and lots of cabling and everything else that you need to make the hospital work. So for other hospitals embarking on major digital infrastructure transformations, what are sort of the key lessons that you've learned that can be applied to other programs?
Yeah, well, luckily I'm part of a group of all the digital facilities builds across the country. So we're all already talking and sharing resources and sharing those lessons. So that's one of the improvements across the sort of digital services reorg that came through. So for Nelson Whangarei, the next couple, we just had the budget announcement about the phase 2, which is Palmerston North, Tauranga and Hawke's Bay. So it's making sure that we're all aligned, we're learning those lessons. But I suppose from the outside in, really focusing on readiness and making sure that people are aware of the changes coming and not just delivering digital functionality and walking away. It's making sure that the land's right, people are trained, people have access to a consistent sort of training environment. They can ask questions, they can get stuff changed. So if you focus on readiness and working backwards from those clinics that are moving or the patients that are going to have that new experience, and work backwards from that, that's probably the best learnings. And just focusing on keeping that sort of customer centric viewpoint. I think whether it's the Kaimahi staff that'll be in there or the members of public who will be patients and their family whānau. I think that's probably that biggest thing which has actually paid dividends already in terms of how we've got feedback and interacted with the end users of the building.
Do you think it's allowed like the digital team to be more connected into other parts of the hospital that they might not necessarily have been, and I guess have those relationships that are going to be important ongoing after the hospital is built in terms of understanding each other's needs and just basically knowing each other so they can talk if they need to?
Yeah. Funny you should talk about that because we've just divvied up all the clinics and services that are moving, and everyone's been assigned at least one. So it's not exactly breaking news, but I'm apparently Mr. Audiology, so I'll be the audiology service's best friend. So no one escaped assignment as part of commissioning. But no, I think the work that the team have done, especially around the workflows and how this clinics and services will use the new building, has enabled that sort of early interaction. And we've been really careful to capture questions we don't know the answers to, come back, work out actually who the best person to answer the question is, and ensure that the question gets answered. The best way to build a relationship is actually demonstrate that. We're not just come and drop something off and run away, because the outpatient building will be in operation for quite a while before the inpatients comes along, but the same services will need to migrate into inpatients as well. So having that sort of trusted relationship will benefit everyone, I think, when the big one comes along. So yeah, no, that's been really good. And just giving the team the headroom to actually have those conversations and work through how services would use our digital tool improvement alongside the enhanced building models as well. So opening day will tell us, and maybe opening day plus 2 weeks will really tell us. But early engagement and individual clinic engagement's been really helpful in flushing out some of those questions. And it's really helped the change team as well to know what we need to broadcast to a wider group of people as well. So it's been really helpful in that engagement and change area in terms of knowing what questions people are asking.
And so looking ahead, what are the key milestones you're most excited about as the new Dunedin Hospital goes from a project to a reality?
Probably the next three are probably there'll be one in a couple of weeks when we actually move in as part of early access agreements. So we'll actually migrate out of the project office actually to working in the building. So there's some collaborative workspaces as part of the design. So as a project team, we'll move in there and start using the building every day. The second one being opening day, because to get to opening day, we've got to have a lot of work done and a lot of checklists signed off and a lot of engagement with services and functional units to make sure that they're happy with the work and they're good to move in. And then I think it's, when we see our first patients, like that's going to be a major day for everyone, because it's been years in the work. Some of the people have been involved since the very beginning. Yeah, I think those are probably the three big ones, because there's a lot of water to flow under the bridge between now and then, but they'll be the ones you remember.
Great. Well, thank you so much for joining me today and sharing the story behind the program. For those listeners who are interested in hearing more from Phil and hearing more about the digital patient journey experience at New Dunedin Hospital, HINZ is running an event on July 29th at the Dunedin Town Hall. It's called Southern Connections, the Future of Digital Health, and you can find out more on our website, hinz.org.nz. We'd love to see you there. But thank you, Phil, and we look forward to seeing the project progress. Mā te wā.